everybody for coming here. This is super, super exciting to see all of your faces and people from LCCP from throughout the years.
I was publishing Outlines newspaper in the early 1990s when the first meetings were starting to be held at the Women's Gym. I attended a meeting with Nancy Lanou and Angela and Patton, Renee Hanover, and a bunch of folks that were really interested in looking at creating an organization that focused just on lesbian health.
Either we were drawn by interest in the environmental links, or we had lost someone to cancer, or we ourselves had cancer. It was a very motley group of us who had many different personal reasons for coming together.
Our primary concern was to have services for lesbians because it was obviously an underserved population. But all women were welcome, and we made it very clear that all women were welcome.
What? Let's get this.
You look the same.
Well, I hope so.
Completely different.
I think everything we did was important. I think our ability to be able to provide free services to underserved communities when we were able to offer free mammograms at the health department facility on 63rd Street and so on. I think those were important because, of course, underserved communities are often forgotten even when we do good work.
I was a cancer survivor, and that was an ordeal I went through in '86. I had a partner, but we didn't say, and she was there all the time, and my oncologist knew, but it was, you didn't want to go there. You didn't want to prejudice your health care. Because who knows what people were going to think, or what they, you might get less care.
We knew we were a group of predominantly lesbians, not all, but predominantly, and we knew we wanted that name in our organization's name because that is what had brought us together.
It was a powerful statement. Nobody was using lesbian in their organization's name at that time.
We were the Lesbian Community Cancer Project, right? Lesbian in the name, cancer in the name, and that was amazing back then.
We saw a way that this issue of being activists around cancer could bring us together with other women in Chicago across many of the lines that divide us.
I worked with a group of lesbians that were some of the most talented, committed folks I've ever known in my life.
I also loved COAC, Coming Out Against Cancer. Mary McCauley, who was our first executive director and instrumental in starting this group, she really organized that first fundraiser. I mean, we all worked on it, but she was the key person. It was unbelievably successful. We all had thousands of dollars stuck in our pockets.
Because we hadn't anticipated.
We had no idea it was going to raise that kind of money. It raised more than our annual budget.
When we were looking to hire the next executive director, many candidates were interested, and then Jessica Hallam submitted, her resume and thought, wow, somebody who was perceived in a different way in terms of a performance artist, somebody who did comedy, and yet learning about the work that she had done, just all that sort of activism on the ground, political work. So to hire her as the executive director just kind of made total sense, and she really sort of, I think, transformed the organization into its next, so it took it to the next level.
I mean, it was a whole different time back then with women's behavior patterns and oppression, as it were, and seclusion than it is today. So, I feel very fortunate to have been part of that movement.
One of the other great things about LCCP was that it gave the women who benefited also an opportunity to give. So you had a really nice complete cycle of being served and serving, and I mean, that's almost ideal.
I think the most important thing to remember about the Lesbian Community Cancer Project, when it was the Cancer Project, was the work that it did, the pioneering work it did around cancer. This is at a time when, other sort of straight organizations, were not, stepping up to the plate to serve us.
We did a lot of advocacy work going into med school programs to educate the new doctors, and we worked with Chicago Department of Health, educating service providers. It was, I think, groundbreaking at the time. And when I go to the doctor, I feel like they're different because we were there.
But I do think that having at least a couple voices on lesbian-specific healthcare is still needed, and as a way to change the mainstream. So it should be on policy and trainings as opposed to always just specifically about the healthcare itself.
There are very few programs, certainly in Chicago, but also nationwide, that serve lesbians and their health and health disparities. So it's really exciting to be able to be offering something that really isn't available in other places.